but it can become an airborne disease. Should you have a patient or somebody in the community that has this, that actually projectile vomits, it can cause droplets in the air to where you can actually breathe that in. If they cough forcefully, if they're receiving any type of respiratory treatment while they're in the hospital or being intubated, anything that can generate an aerosol, then that's when it becomes an airborne disease. But mostly you're going to worry about droplets. That's when somebody can cough or spit on you, or when you can actually have breaks in your skin, or they have blood or body fluid exposed that can get into your mucous membranes or broken skin. So we're going to practice here at the hospital an airborne precaution as well as a contact precaution. Healthcare workers, family, and friends, anyone that has close contact with someone that is infected with Ebola are going to be the highest risk for getting this virus. And that's because you're going to be taking care of them, you're trying to get them better, and you're the one that's going to be exposed to those blood and body fluids, whether it's vomit or feces or maybe some type of bleeding. So those people that have to come in contact with those things are going to be at the highest risk. Just like the flu. If you take care of somebody with the flu, chances are it's going to spread around the house and everybody's going to get it. So we really want to be real cautious. We want to make sure we wash our hands well, careful hand hygiene, making sure we cover our cough, wear a mask if necessary. You know it's flu season, so those are good practices anyway. There's no approved vaccination available. There's no shot we can give you to prevent you from getting Ebola. Just like the flu shot, we don't have anything that we can give you to prevent you from getting it. They are working on a few vaccinations, but they have not been successful at this time. There's not an antiviral or a cure that we can give you. There's not a miracle drug that we can give you so you can get better from this. As healthcare workers, we're going to make sure that when you're in the hospital, that we're going to wear the appropriate PPE, and again, you'll see that demonstration. Careful hand hygiene like we talked about, and just a careful removal of that medical equipment. So what happens whenever we have a suspected patient? So a patient will come in through the ED or the clinic, and they may let us know that they have traveled, because we're going to ask about that. We're going to ask where they traveled, how long they were there, those kind of questions. We're going to take their temperature. If you have a fever of greater than 100.4 or greater, and you have an additional symptom of a headache, muscle pain, vomiting, diarrhea, abdominal pain, and unexplained bleeding, then you're going to be a patient under investigation, or a patient of interest, just because we're concerned about your travel history, along with you having these symptoms. So the first thing that we're going to do is we're going to ask you to be isolated into another room. That just means we're going to take you from the waiting area and move you into a room by yourself, just so we can call DHEC and let DHEC know that we have a patient here that has had a positive travel history, they are experiencing a fever, and they have an additional symptom. DHEC will then have us go back in the room with you all and just go through another screening process. Where were they? How long were they there? What were they doing in that area? What do they do? What is their profession? Do they work in healthcare? Do they work in a school? What were they doing? Did they have any connection flights? Case by case, what's going on with you? Then we'll go back in the room and of course and ask you those questions, and if we get the answers that are all looking toward a risk, then they may ask us to quarantine you. That may mean bringing you to the hospital, putting you in a negative pressure room so we can take care of you. That may be no, even though they've traveled and they have these symptoms, they're still not a risk. Just have them self-monitor at home. Self-monitoring would be that you take your temperature every day, and you of course either call your doctor or call the hospital to let us know that you're having these symptoms. But we would give you that plan at that time, that contact number. We can run tests, but the running the test or drawing the blood is not the hard part. The hard part is actually running the test. DHEC has to be the one to say, yes, you can test for Ebola. We can't just run the blood through the lab like we do a regular patient. We actually have to notify DHEC that we have a case. They'll say, yes, you can go ahead and test them. They notify the CDC. CDC will then allow us to draw the blood so they can actually send a courier to pick it up from our facility. The drawing the blood, like I said, is the easy part. We can actually test for the virus itself, what the load is, how much you are infected, as well as finding out is it currently an infection. Once we do that, it actually has to be packaged in 4 separate containers on dry ice or either frozen. It actually has to be decontaminated from the outside in. And actually, there has to be a special courier that monitors that lab. It doesn't get sent right straight down to our lab in hospital. They have to wait for CDC to get here. It's packaged different. It's labeled differently. And then they'll actually send somebody with a permit to come and pick that up and remove it from our facility. This is kind of just a little sheet that the lab will follow. It gives them step-by-step instructions on how this is handled until CDC gets here. The bottom corner, if you can see it, it shows how it's actually packaged and decontaminated. Again, so what are we going to do for you when you come to the hospital? If there's no cure, there's no vaccination we can give you. You can still recover, depending on your immune response before you actually got the virus. But if we're going to make sure that we can manage your symptoms. Of course, you're going to have the vomiting, the nausea, the diarrhea. You're going to be losing a lot of fluids. So what we're going to do is we're going to give you some IV fluids. We're going to balance your electrolytes. We're going to maintain your oxygen, your blood pressure, and we're going to treat any other infections you may get, along with any other symptoms. At that time, that's all that we can do at this point because there is no cure. We may give you some IV antibiotics, but you can recover. Like again, it's based on your immune response, making sure you are in good health, eat right, make sure you get enough sleep, exercise. Try not to get the flu during flu season because that will weaken your immune system. And then, of course, it will be harder to fight off any other type of infection that should you get anything. So stay in home, not traveling if at all possible. Limit your travel, covering that cough, making sure you use good hand hygiene, and just monitoring the people that you're around. You can recover, but you can also infect people for up to 3 months, especially by having unprotected sex. So that would be important. You can also have long-term complications, but I don't think there's enough studies out there to tell us exactly what those complications would be, other than they said you could probably have joint pain and vision problems, and that's the CDC, this information. They ask us to always use disposable medical equipment if possible, and all the waste generated by a patient with this disease would all be deemed biohazard. And what that means is this waste cannot be mixed with our normal biohazards, such as our needles, our blood contaminants that are in our red bags. We can't just mix that with normal biohazard here at the hospital and have our courier take those away. We actually have to keep that biohazard in the room, and that means anything that the patient would generate, such as normal household things, Kleenexes, food trash, bed linen, gowns, anything that we as healthcare providers put on, that's all biohazard. And again, you'll see that in a minute when they demonstrate. So this can generate a lot of waste very quickly. We actually have to have a special courier with a permit that can actually move Ebola-infected waste. We can't just send this through the normal courier that removes the trash. So lots of things we've had to think about.